In the last 30 years, intervention for blood vessel problems has dramatically changed. When I finished training, everything was major operative interventions, and the field through technology and marvels of technology has evolved into where over half of what we do is done through minimally invasive techniques. You'll hear the word angiogram or percutaneous. Everybody knows what a heart cath is. You can be stuck in the radial artery or in the groin and have your heart arteries evaluated and intervened. The same thing is done through the rest of your arteries. And 50 to 70% of our interventions are done with minimally invasive techniques through angiography. It is a complex field. One of the things that the administration here provided when I first came, and I told them they had to have all the tools. These aren't toys, these are tools to open blood vessels, stent blood vessels, image blood vessels, be it intravascular ultrasound, or drug-eluting stents, or drug-eluting balloons. These are the finest technologies, and we have them here. And what we do offer to the public is access to that. And if you're scheduled for an angiogram, it sounds like a terrifying procedure. It's done under sedation, local anesthesia. You're not put to sleep. 90+% of our patients are going home that day. If they live too far away from a radius, or I believe they need to stay overnight, they stay overnight. But it is a minimally invasive technique which has dominated vascular surgery now for 10 to 15 years. We will do angiograms to assess circulation after typically a non-invasive vascular lab test is done. If there's a problem, we're doing an angiogram to not only map what the problem is, but hopefully fix it. Now, most of our problems come from blood vessel blockage. Imagine a shiny copper pipe in the middle is corroded and corrupted and there's no circulation. That's a blockage. The other problem is aneurysms, when your balloon dilates. So most of those are now manageable through going through an angiogram to repair them. And there are various stents and or devices that fix these vessels, and that's how we do the bulk of our work now. If I am considering an angiogram and any intervention on a patient, a thoughtful checklist of risks and benefits and pros and cons are discussed by me with the patient and in the family. I will not do a procedure on a patient without family. I just won't, because it's a big problem. It's a big issue. And if you decide that a patient has too many complexities and cannot have something done, that's an important decision to make. And it requires consideration of a multitude of risk factors, not only the patients, but home factors, etc. So there is a lot of thought process going into this decision.